Let's be clear, HIV is an infection, and anyone can have an HIV infection without having AIDS, but a person who has AIDS already has HIV. Now let's talk about something called CD4 cells. They're often referred to as T cells, T lymphocytes, or helper cells. They're important to the immune system. They stimulate other immune cells to fight infection. Are you as confused about HIV and AIDS as we are? Well, HIV is the virus that causes infection. Now let's explore the effect of HIV on CD4 cells. They attack and kill those cells, and as you know, those CD4 cells are what helps with our immune system. So when they're attacked or literally destroyed, they make it hard for the body to fight off infections. Now let's talk about AIDS. AIDS is the last stage of HIV infection. The amount of HIV goes up, and sadly, those CD4 cells that protect our immune system go down. HIV advances to AIDS usually in about 10 years without medication. So the CD cell count for a person with no HIV is somewhere between 500 to 1500. Therefore, a CD4 count for someone with HIV whose count is over 500 has pretty good health. What's concerning is a CD4 count below 200 in someone with HIV. This means they are at high risk of illnesses. So if you have HIV, it's important to start treatment as soon as possible. The goal is for the viral load, or the HIV, to fall and for the CD4 cell count to increase. And this rate varies between individuals. No one is the same. This is just a visual of what you want your body to look like if you have the HIV infection. If you look at the first tube, there are tons of CD4. And remember, CD4 is good because they help fight the immune system. And in the second tube, there's a low level of HIV. So that's a low viral load. This is how we want to be. This is how you remain healthy with HIV. This public service announcement was brought to you by the Central Jersey Alumni Chapter of Delta Sigma Theta Sorority, Incorporated.